Hi, folks. Welcome to another edition of An Hour with Bob. I'm here with Aaron Guckian, who is the executive director of the Rhode Island Dental Association. Aaron, great to have you on An Hour with Bob. Finally, I finally get you to come on my show.
Yes.
How you doing?
I'm excited. Yeah, and, it was great bumping into you in Newport, and I'm having a good day today, and I'm glad we could make this happen. So thank you.
Yeah. And that was funny that I even ran into you because I hadn't expected to be I took the ferry down.
Yep.
A friend of mine said, "Hey, want to take the ferry down from Providence down to India Point? We'll go down to Newport for the day." I go, "Yeah, sounds good."
Yeah, it's great. It's a great way to kind of visit Newport and go back to Providence. You don't have to worry about
No parking.
The parking.
Going over the bridge. If you don't have the transponder,
Yep.
What's it now? I don't know. It's at least $4.
Yeah,
right?
at least 4. Yeah. I mean, I've got the transponder, so I don't.
Do you know what
easy
it costs
pass.
with the transponder?
I think it's like $4 or $5 maybe.
No, with the transponder.
Oh, it's like
85 cents.
Yeah, something like that.
Something like that, which is crazy not to get the transponder. I tell people all the time.
Yeah, that's the Turnpike and Bridge Authority.
And it's good for all the way down the East Coast.
Correct. So a little shout out to that group and Easy Pass.
I don't know how that affects in the Washington Bridge in New York, which is like $15 now.
Yeah,
I don't know what cut you get, what break you get from that. I never found out.
Yeah, I'm sure you get, as long as they're in the system or the infrastructure, I'm sure they get a sort of a discount, right? So.
You would think.
Yeah.
And if it's as high as they're getting here, that'd be a big discount.
Yeah, it'd be a big discount.
It'd be a couple dollars versus $15.
Yeah.
So what's going on with the Rhode Island Dental Association?
Yeah, well, I'm the executive director of the Rhode Island Dental Association. We're the leading advocate for oral health in the state. There's the American Dental Association, the ADA, where most people will see it on their products, or they see it in the commercials. And they've been around since 1859. They represent about 160,000 dentists and has one of the most powerful political action committees in the country, well-funded. And we were, around 1878, we were established. So long-term, representation from a trade association. So I've only been doing this for a little less than 2 years. I'm really happy every day I wake up and try to promote good oral health. And I was just up at Burrowville High School, promoting career pathways and oral health. So that was, it was good to see the kids in high school and tell them about, the opportunities out there. You
brought something to my attention, which is troubling. That is that dentists in Rhode Island, on their paybacks, their reimbursements, they only get, about 80% of what they get in Massachusetts? Yeah,
well, I mean, if you just take, for example, like a cleaning, most people know their hygienist.
Sure.
And, we need more hygienists. CCRI in Lincoln is the only accredited school.
That's the only one?
Yeah.
And only in Lincoln?
Yeah, only in
Not
the Lincoln
in Warwick?
campus. Yeah, so we're trying to get, especially dental assistants and front office managers. But in regards to reimbursement, we talked a lot about it in the last session, is there's a real difference with our neighboring states in Connecticut and Massachusetts. So an example would be a cleaning, or what they call a prophy, but $71 to $74 they get currently from the insurance companies
in Rhode Island.
In Rhode Island, but if you go to Massachusetts, they get $100.
Oh.
So
that's 29% more.
Yeah, I mean, I don't want to do exact numbers, but
it's approximate.
But it's a big gap, and we do have a different we have a bigger Medicaid population here in the state. However, with inflation right now and the costs and the regulatory system and the fees, it's really put a squeeze on the dentists. And what I try to convey is there's 5 dental schools in New England. 3 in Boston. You got Harvard, Boston University, and Tufts. Then you got UConn, and then University of New England in Maine. But what happens is when they do an analysis of the landscape, if you can make more money in different states, you're not going to relocate.
Right.
And it's very difficult.
There's no incentive.
Correct.
There's no incentive.
And it's difficult to get the specialists. So right now we have less than 30 oral surgeons in the state.
Right.
And pediatric dentists, periodontists, which is with the gums. You're talking with the senior population. and people have teeth longer now. So it used to be.
why is that?
Well, it's just
They're not eating as much
junk
sweets.
and sugar and good hygiene, good diet. So now all of a sudden what happens is the difference between regular health care, right, and the ADA didn't, the Affordable Care Act, excuse me, ACA, didn't include the eyes and the mouth. So
Really?
yeah, so it's like taking the mouth and putting it here, or the eyes, and just putting it on the table and say, we're going to
Do the rest.
Right, and it's like a gift card that you get from any of our dental insurance companies. So usually it's like $1,500 to $2,000. And so that will cover your cleanings and some small procedures. But for, our seniors out there, when you need an implant,
Right.
you get a tooth infection, which most people don't know, but you can die from a tooth infection.
Really?
When you have these sort of larger issues,
Right.
you get that $1,500, and now
Or a
you're
root
paying,
canal?
right, and then you're paying out of pocket.
Yep.
And it's very, very expensive, and it's sticker shock. And most people don't have access to those dollars, and it's concerning. And so not only is it difficult to pay for it, but then try to get scheduled. So I'm like getting all sorts of phone calls.
Right.
A guy like you, we know a lot of people. Person like you, let's say you get some sort of emergent problem. Usually it's on July 4th or when you don't want it to happen. My dad's a plumber, same thing. You get the clog on Christmas Eve, and you're getting the calls. But the bottom line is, you're calling me. It's like, I know a guy. Everyone's trying to put, and the system isn't working.
Right.
So, I'm really happy. I've been working with the governor's office and the legislature and our government affairs team to really kind of shine a light on this. And I'm happy for this opportunity to kind of keep talking about it and keep the conversation going.
Right.
Yeah. Another thing that's happened is with the children, especially in the urban core. I was out in Burrville, sometimes out in those locations. It's harder to get dentists, right? It's harder to get. Let's just say in Providence, the children. Dr. Greg Stepka, who does all the dental screenings, which is mandated all over the state, so all kids are supposed to get dental screenings.
Right.
But he writes up a note.
Now, every kid's supposed to, when they're in school, is that what they do?
Yeah, get a dental screening. And so he writes up a note that's supposed to go to the school nurse, thank you for the school nurses out there, to the parent, and then either go to a private dentist or to a federally qualified health center, like Providence Health Center or Thunder Mist or a clinic, yeah. The problem is transportation issues. There's a lot of different things that come into play. And in George J. West, which is near Mount Pleasant, the Mount Pleasant section, over 80 children need emergent dental care now that require anesthesia. And
that require anesthesia?
Yeah, so it's like these kids have so many issues
Right.
that they need multiple extractions.
So they need to be put out.
So it doesn't necessarily mean they have to be, but that's the
Right.
recommendation.
Right.
So now you got this backup, kids getting out of COVID. They weren't going to see their hygienist. They're not using or being educated and not using brushing their teeth and flossing.
Right.
Not eating correctly. I mean, one of the stories that ran with one of our dentists, he said, "Thank you so much for looking at my teeth. I'm in a lot of pain." And he took out a Tootsie Roll and gave it to him as like a gesture to say thank you. And that's the problem, right, is they're eating sweets and the sugary, consistently. And now we have a big, big problem. And it shouldn't be happening in the United States of America, what I'm seeing. And I'm on the ground. I'm going to the schools. I'm going to these screenings. The Title I schools, we need a boost. Unfortunately, there is something called the sealant program.
Which is what? What
Which
is that?
prevents basically the dentist, the hygienist puts sealants on. And to everyone out there, I'm not a dentist or, I promote and I do my job, but I'm not, a dentist.
But you play one.
But I play one on TV at Bob's, an hour with Bob. But bottom line is, it was a federally funded program that we didn't get the federal funds this year. So these dentists, when they get these sealants, a lot of these FQHCs will put federally qualified health center. I know it's alphabet soup out there, but it's they're not going to get it, these kids. So we're trying to figure out different ways of funding. trying to be supportive. There's something that's for adults, which I was talking to you offline, which is called the Mission of Mercy, which is a free dental clinic that's going to happen at the Providence Health Center on October 5th and 6th.
And where is that, the Providence Health Center?
It's on Prairie Ave. There's a few locations, but they have this, it's over 10 years. I think this is the 10th year, or maybe 11th, but they're their own separate 501c3. Libby Swan is the executive director, but a lot of our dentists participate.
Yep.
And they donate their time and talent, and it's this big MASH unit. So they triage people, they get them in. A lot of, it's a public-private partnership. A lot of private companies support it. Our dental insurance companies do it. And they line it up. So we have dental assistants, hygienists, dentists, the specialists, and they have an incredible, operatories over there, all the dental chairs, and they're just doing whatever they can.
And they take care of people even that have to put them out? Even if they
Oh,
have to put 'em
well, I don't think that they do anesthesia. However, there's different ways that they work. And again, I don't want to wade
Well, they give
into
them
it, but there's a
laughing gas
lot
or
of
something.
procedures that are done by oral surgeons, periodontists, the specialties that they would probably never be able to get to. And everyone comes together to try to fix this. But unfortunately, as a policy person, this is like a Band-Aid
Right, yeah.
on a special weekend.
And it's only a couple days.
Right, and I give them so much credit. However, overall, and we did pass a bill that's going to go back. It's a study of 23, 24, and 25, and then on or before October 2026 through the Office of Health Insurance Commissioner, Corey over there, they'll do an analysis and they'll get a true dental loss ratio. So our big argument was to the legislature is patient premium should go to patient care, not administrative costs.
Right, right.
And so in Massachusetts, they had passed in the last cycle in 2022 by referendum that 83% should go to patient care.
Right.
So it's 83 cents to the dollar.
Right, right, yeah. So
So all of us-
17 cents goes to administration.
Right, exactly. And that was, it was like a bomb went off in the industry.
Really?
But they got it on the ballot and it was a referendum. What people don't understand is how difficult it is to get legislation through. Because as they say, one person can kill a bill, right?
Right, right.
But I'm happy to report that, the Speaker, the Senate President, Governor, Senator Gallo, DePalma, Chairman McNamara, and many, many others. I hate to start naming too many. But, came together. We had some really tough negotiations with the dental insurance companies, and their representatives. But ultimately, we came to this agreement, and it passed. So help is on the way.
Right.
However, we are still in this sort of crunch for the next 18 months. And,
So the help doesn't come till 2026?
Well, it says on or before. So, to be fair, we couldn't go back during the COVID years to do an analysis. That we made an agreement that we went back a year. There was a lot of people who wanted to go forward, but we got 23. We'll end 24, and then one more year, which is 3 years, which is the typical sort of
Research or whatever you want to call
They'll
it.
do the research, the analysis, and they'll get a true dental loss ratio. And I'm sure there'll be hearings.
Now, you call it what you said? You call it a dental loss ratio?
Right. So they say MLR, medical loss ratio, dental loss ratio, DLR. Again, to the people out there, we're getting into the minutia. But bottom line is, what's the reimbursement rate?
Right.
And it's not as much like, so for the dentists that, so many of these dentists, there's a lineage, right? The grandfather might have been dentist,
Right,
it's passed
right.
down to the father,
Yep,
the son,
yep.
the daughter. And some of them own the building, which makes it a lot easier.
And a lot more affordable for them.
Correct. But our young dentists or people that come out with this big, big debt load,
Right, right.
and if they go to certain private dental schools, it can be like upwards to $400,000 that they come out with.
Really?
Yeah, and you start taking that, and then you want to start a practice.
And where you going to start, in Mass or Rhode Island?
Well,
You
yeah,
wanna get
exactly.
70-something cents on a dollar? You want to get?
Yeah, or right, exactly. And there's just too much of a gap. So we're really trying
Yeah.
to advocate for them to come together. I did hear that, and there's been some publications, that one of the insurance companies is going to roll out some changes and maybe up the reimbursements in the fall. I'll believe it when I see it, but
Right, yeah,
I trust that their communications is true. And I don't like to, on these, on any of the shows, to try to single anyone out. So, there's 2 or 3 sort of the big dental insurance companies in the state, but I don't like to say this particular one or whatever, because I don't think it's fair to them. But, overall, we have, a pipeline issue. I was talking about the hygienists and dental assistants.
Right.
In 2 years, you can, with certain prerequisites completed, you can become a hygienist.
Exactly.
And
they make good money.
Really
they
good
make
money.
really good money.
Flexible hours.
Yeah, exactly. Yes.
Everyone's
you can
talking
write your
about
own
nursing.
hours. You can set your own hours.
Yeah, everyone's talking about nursing, and my mother's a respiratory therapist, and the lack, and a lot of this I talked on my last campaign, but just this aging out and really trying to get into the schools. So, I'm happy that I was just talking to the kids at Burrillville, and they ask great questions. These technical schools, they have certain paths, and I had a lot of hope. They were asking great questions. They didn't know about CCRI.
Right.
They didn't know about that they can get paid well, and also just a couple years. And we have public health hygienists. That's a little bit more of an accreditation. They can go into the schools. Something I'm working
Now,
on.
public health hygienists, like
Hygienists.
one step hygienist.
Yeah, just
they're
a
one
little
step
bit more.
above.
Yeah, it's a lot of hours that they have to. It's almost like a journeyman, and then they have to put in certain hours.
Sure.
To be, my father's a plumber, so the local union, Local 51, by the way, we don't have enough plumbers either. But and steam fitters. My Uncle Pat up there in North Providence, but Jacksonia Drive. Prying him out of there. I call him like, "Hey, Uncle Pat, let's get a lunch." He's like, "I'm retired."
Yeah.
Yeah, great guy. But
Does he expect you to ask him to do something, fix something? in the
yeah,
house?
right, exactly. Take his garbage out or something. But
Now, doesn't New England Tech, don't they do something
New
there
England
too?
Tech is getting involved. Steve Kitchen, my good friend over there, he's been there for years.
Who is it? What's his name?
Steve Kitchen.
He's been on the show.
Yeah, great guy. Has done years and years. He's a councilman in Mass, and so much time he's committed for workforce. He's one of those people I call when
You
I'm looking
lean
for
on?
help. Yeah, definitely. I think that this next legislative session, we're looking maybe at some sort of tax incentives, or maybe lowering some of the fees, or and I'm actually leaning on the American Dental Association to see what's going on across the country. So I'm not reinventing the wheel.
Right.
I'm going to the national conference. It's called SmileCon. It's in New Orleans this
Oh, really?
year.
Yeah.
I'm really excited. And
Well, I'd be excited too. I've been to New Orleans.
I've never been to New Orleans.
I've been to New Orleans.
I'm a little worried. I might
it
get
depends.
lost in the French Quarter.
It depends on what time of the year. When is it?
October.
Oh, good, because it was in
and-
February.
Oh, forget it. I wouldn't go down there.
I've been there during
I'd be
the Mardi Gras. I've been to
divorced.
Mardi Gras. I've been to Mardi Gras.
Yeah, but yeah, I mean, so they have the national conference, and they've always had Give Kids a Smile, one of the initiatives of the American Dental Association Foundation, right? The 501c3 arm for those accountants out there.
Yeah.
But now they're doing Give Vets a Smile. And one of the communities where there's a real gap is our veterans. And I spoke about our seniors.
Sadly, yeah.
Yeah, and the VA does the best they can, but what the American Dental Association and their board decided, said, hey, let's do a little more. And so it's going to be at the World War II Museum in New Orleans. And I was talking to Senator Reid, and I didn't know we had a World War II museum in Wakefield. And there's a big sign as you're taking the exit, but I never saw it. So I guess it's a much smaller one,
Right.
obviously. But I can't wait to go there.
Me neither. Now that you say it.
Yeah.
I think of the World War II Museum in or the statue in Woonsocket.
Yeah, exactly. So you got that one.
That's what I thought you were going to say.
Yeah, but there's like a little museum down there, so I can't wait. You always get these little pearls in Rhode Island. You know?
And there are a lot of them.
Yeah, but I was really honored. The chair of the foundation board wrote me an email last week and said, "Would you sing the national anthem?"
Oh, that's right. Yeah.
Yeah. So I've sung a lot of gigs. I've done, the Governor Kachiri and his inaugurations. And,
Well, you worked for Governor.
right, I worked for the governor, and I've had a lot of special moments singing. Some people might know I'm an opera singer.
Right.
And trained and did it across the country
Now,
or the world.
which?
But I'm singing the national anthem, so it's going to be exciting, and I'm grateful for the opportunity. But the real main point is, even our National Guard. I've been talking to some retired generals. My good friends.
Reggie?
Yeah, well, General Centracchio is a great friend. General Dunn, Jimmy Dunn, he's really great friends with mine. He's a 1-star. And talking to the leadership to see, there's like major gaps. And so I think if we just keep talking about it, keep sharing your stories, things start to happen. And, I can't say enough about our federal delegation. I know that it's a political season and everyone wants to be negative and say, I disagree with this person on this, and then they make it personal.
Right.
What I try to do is, unless the person is very difficult to deal with, and I don't find that with Rhode Islanders, is, what do we agree on? Let's forget about what we disagree on.
Right.
And
And mostly the disagreement is D or an R. That's mostly
right,
the
or it might be a social issue or something that's really, like the hot topic. But oral health and the importance of it, it resonates with people, and it's a health equity or an inequity, so issue. So I never knew this much about oral health, but if you watch your advertisements and commercials,
Yep.
You see Colgate, you see Invisalign, you see teeth whitening, and it's orthodontics. It's just incredible, and it was right in front of me.
Right.
And great people doing their best work, small businesses being influenced by this inflation tremendously, and if no one talks for them, they're just constantly, what I say, doctoring. So it's very difficult for them to promote policy or do things because they're busy working.
Right.
And they have so many emergencies too, because it's not like everyone can just go to the hospital. If you have a tooth issue, unless, like get into a car accident or an oral surgeon has to take care of it, it's like a lot of them get calls, right, on the worst days, and they got to go in.
I know one very well.
Yeah, who do you?
He's a good friend of mine.
Oh, yeah. Maybe Dr. Ward or up
Nope.
there. Oh,
No,
okay.
in Cranston.
Oh, okay. You got to tell. There's a lot of dentists out in
All
Cranston.
right.
Yeah.
Scully.
Oh, Dr. Scully. Yeah, great oral surgeon.
And a good friend. He's become a good friend of mine.
Just a super talent, and he does so much and he would never say this, but the special needs community.
Exactly.
Zambrano.
And
very complicated procedures.
And he does the ACI.
Yes,
he goes to the
exactly.
ACI. I don't know how many Wednesdays a month, but he goes to the ACI and he takes care of serious cases there.
Yeah, that's another part of the community that I didn't realize, but it makes sense. You need dentists there.
I went in his office. Well, I can say because I'm not saying names. I walked in his office one day to see him because I stopped by just to say hi and bullshit with him a little bit. And
Yeah.
I walk in there and he's got his 2 guards there. And,
Yep.
And I go, what the heck's going on here? And they got a guy handcuffed to the chair.
Yeah, and again, people can die, so
Right.
they should be getting care just like everybody else.
Well, this guy had broken his jaw in 2 places.
Yep.
Oh,
And
somebody
sometimes
broke
it's a
his jaw.
fight. Yeah.
Yeah.
That's a lot of times, on the weekends. Not talking about the prison population, but certain things happen, right?
And Zambrano, like you said, does work up there, and he really took it bad. They really. He took on the administration there a couple of years ago with the mask and all that stuff.
Yeah, that's something that the COVID and the vaccine. And again, like you were talking about hot button issues.
Right, right.
Thankfully,
And
that's...
he got.
Yeah, I mean, it's...
It cost him.
there were a lot of different...
Had to be over $1 million. It cost him.
There was a lot of different opinions out there. I think doctors and researchers should have been at the forefront.
Right.
And I think a lot of times the politicians were leading.
Exactly.
And I think it got
out of hand is what it did. He was the only one that got his license pulled for a while.
And again, I don't want to go too far into that, but I think that everyone should be able to have their opinion.
Exactly.
But it was tricky because you're balancing public health.
Right.
And, you know, I just support my dentists. I mean, they were in a very difficult position. I was not at the helm at that time, so I don't really want to go back there because I can't really speak to it.
Right.
But just generally, you know, it was complicated. Yeah. But getting back to, you know, treatment of special needs in the pediatrics, I'm very happy to report that we got this G0330 code, which is a Medicaid code that pays for an ambulatory surgical center. Keep it very simple, a facility fee. So another big piece to this is CRNAs, right? Certified Registered Nurse Anesthetists. There's not enough of them. Anesthesia.
Right.
So it pays.
So they're one step below an anesthesiologist.
Well, I wouldn't say below, but
Close to.
But yeah, right. The different qualifications, but I know they're not doctors.
Right, right.
So what happens is where it's these kids in Providence or whatever, it's $250 they were getting paid for the Medicaid reimbursement. This gets it almost to like $1,200 to $1,300. Don't quote me, but it's about $1,000 increase. So now we're really trying to work, and Senator Palma and Gallo were and Speaker were very influential in getting this through, and from Johnston, Fiala, excuse me, representative in Johnston, to put this together. And now it was kind of last minute. We got kind of clipped onto the budget, and it passed. So we have to get through some regulatory stuff and whatever they do on the back end with Medicaid. But it's a perfect example. If you work together, you can get this code, and then you can get these people to support. Because if you're running a surgical center, you still got to make money.
Yep.
And this basically ensures that now that they can get in there, they're oral surgeons and pediatric dentists and get to work. So we're working with some of the hospitals. We're having some sit-downs with some surgery centers and trying to figure something out. But as you know, if you don't have the code, you don't have the reimbursement, it's not going to happen.
Right.
So we got that.
It's all about the code, right?
Yeah, it's all about getting paid. And then people will come and be able to figure it out. So we're getting there. We're making a lot of strides.
But how do you keep these dental students from not coming to Rhode Island? Because they're not getting paid.
Right.
You gotta even the playing field.
Right. So I mean, we don't have a dental school here either. So we're already behind the 8 ball.
And why not?
Why
doesn't URI or something?
Well, you know, URI is talking about a medical school.
Right.
You know, I've been keeping.
Why doesn't Brown have a dental school?
Well, yeah, I was talking to Brown about different things with oral health. They're starting to roll out a program for oral surgeons. We're behind the 8 ball, bottom line. And even when they go through this residency program at Samuel's, which is that nonprofit on the campus of Lifespan, that we can't retain these.
Right.
You know, and then the Tri-County, which is, you know, they closed in Providence, they had to close one of the clinics, and now it's at one of the other federally qualified health centers in Tri-County.
Why did they close it?
St. Joe's.
Oh,
so
yeah.
St. Joe's was closed, and you know, my father grew up in Washington Park, right? And I kind of repeat this, but people get it. It's like, it's one thing to get a kid to St. Joe's in that part in Providence. It's another thing to tell the parent you got to get them to Johnston.
Right.
Or North Providence.
Or South Kingstown or something.
Right, exactly. So, you know.
And you got to go several times.
Well, that's the other problem, right? So, I mean, you know, I think the great news, though, is that we're shining a light. You know, a few of the legislators up there were laughing. They're like, Aaron, no one talked about oral health. He goes, now everyone's talking about oral health,
There you go. You're doing
And-
your job then.
Yeah, doing my job, and I've been really, it's just such a great community. And I wouldn't be able to be successful up there. As I told them all, I said, look, you can either complain or get organized. And we got organized. They all got up there after they were exhausted after like a Tuesday, because these committees are kind of last minute at the end. Over 40 dentists went in there, from the older dentists, the younger dentists, from all different parts of our state.
Yep.
And was conveying the same message, right?
They all got the chance to speak, or
Right,
a lot of them?
yeah, because they hadn't gone up there in those types of masses in a long time. And they spoke to the issues, and they spoke to the committee, the healthcare committee, or the Committee on Health in the Senate, and it resonated. It's like, it's one thing for me to get up there. I'm a paid person, right,
Yep.
from the association. It's another thing when you got all these doctors saying the same thing, like, we have to get better. And to the dental insurance, it was a tense. We had to roll ads. It's never easy, but I give them credit that they're trying to identify something and maybe roll out some changes before they're, I wouldn't say they're forced, but they'll be recommended heavily that they change. And who knows where it is in a couple years? You don't know what the data is going to say. But I have an MBA. I'm a trained banker, and I get very frustrated when anything, whether it was what we were just talking about with COVID, with the science,
Yep.
or with the data. We got to get the data and the numbers, and then how are we extrapolating or getting that information, and then
Out to people.
right. But no, and then we can figure out what the actual ratio is and what the reimbursement should be, and then it will put it to bed.
Well, why can't you just look at what Massachusetts is doing?
Well, that was what we argued, that was our first part of our campaign, was that let's match the number, or at least
Right.
get it up to 81, 82, because they're mandated at 83.
What do you mean they're mandated 83? What is
So that was the referendum. So it was 83% has to be for patient premiums rather than administrative costs. So that's rolled out in Massachusetts. In Rhode Island, I think the Constitutional Convention, ironically, is this year that you can vote for it, but you know how complicated it is to get a referendum through a Constitutional Convention. It's almost impossible. So, we have to do it with bills, and as it went through, and there were different recommendations from different national organizations that they said it should be more of a study or a comprehensive analysis.
Everything's a study.
Yeah, but I would say that at least it's got, and I don't want to make a joke, it's got some teeth to it. But, my
Well, you did
bad,
make-
my
you did
bad
make a
humor,
joke.
right? I'm starting to get the dental humor. The filling station and,
Yeah.
the jokes that they got. But it's progress. And, some people, they call it half a loaf up there.
Well, you got to start somewhere.
You got to start somewhere. And it's difficult to just say, this is the number with no data, and we got to go. Now, they did that with the Affordable Care Act, which is 85. So we started at 85, mirrored the Affordable Care Act.
Right.
And there's a lot of momentum and a lot of conversations in Washington that maybe that's what should happen.
Well, what is it now?
Well, our dental loss ratio depends on where you get the data from, right? And then
Oh,
there's...
it isn't, what do they say? It isn't statistics that lie, it's liars that
Correct. It's
use the statistics.
what I would say is this, right? Because there's this big disparity between Massachusetts and Rhode Island.
Yes.
Rhode Island and Connecticut, and that's
How
a
is it
fact.
Connecticut? How much is it in Connecticut?
Similar. They have pretty good reimbursements. They're fighting sort of the same fight we're fighting, but it's healthcare right now in the United States is very complicated. And, running these types of insurance companies is not easy. But having conversations and getting to the table is important, and making sure that legislators can then what they're supposed to do, legislate.
Right, right.
And between those two bills, so we got two things passed in a little less than 16 months. So, I'm really proud of it. Usually takes 3 to 5 years.
Exactly.
Yep. So what else you got?
Well, I worked at the State House years ago, and I know what it's like up there just to get anything done.
Yeah,
If you don't have the speaker on board, you got nothing.
Yeah, and Speaker Shikarchi, along with his leadership, Blaise Juski and Kazarian, like for example, we had this bridge issue, the closure. And what a lot of people don't know is, our dentists were down in that area. So the east side in East Providence,
Right.
they're down upwards to 40%.
Their businesses
Their
down?
businesses when it first shut down.
Right, right.
Then it loosened up and now, things are moving. However,
Yeah, but how do they recover all that
that's
loss?
the problem, right? So, I was at the rollout, I don't think it was this week or last week, where the governor talked about with Commerce RI, I always want to call it EDC because Economic Development Corporation, remember it was that?
Yep.
But, worked with them. We had two co-chairs, the DOT, Department of Transportation, people from Commerce. We all got together. We met multiple times. We took surveys. We got the data. We sent that in to them, answered all their questions. And, it puts us in a position where we can apply for these grants. Now, they're small grants. It's $2,500, I think $1,000 and $500, depending on your category. But it's something.
Right.
And we're getting something started. It's hard.
And it's not a payback. It's not a loan.
Right, it's not a loan, so I think the application is still open now. The east side and specifically East Providence, that's where they're really been crushed. What I've been talking to the governor, and I think I'm getting a little momentum, is we have a lot of our surgeons, not just the oral surgeons, but just people that are on the front lines that work at Lifespan. What I've talked about is, during snowstorms, they can get a police escort over 195
Right.
or anywhere.
Right.
What I'm saying is let's get ahead of this before, the heating season, before we get the snow days. It's already tricky, right? Because like Dr. Hartman and Dr. Brown and, many oral surgeons, Dr. Scoli, but let's just say, you have an accident or God forbid, there's been a shooting and you get it in the jaw. There's only a few people in the state that can have the talent and the wherewithal to get you better.
Right.
Now, let's just say Dr. Hartman, who lives on the East Bay, has to get over the bridge, and let's just say it's a 45-minute delay.
Yep.
Well,
So you're saying put them in a state trooper car?
well, not a state trooper car, but I think he could call ahead to the sergeant on duty.
Right.
But there's a list of all the heart surgeons or, whoever it is, right, that is on a list, and they're not going to take advantage of this, and just say, hey, I've got a major operation. Can you get me over there? There's already state troopers that are
They're on there. They're
already
anyway.
there. So
Yep.
if
Yep.
they communicate, you can get them right over the bridge. And it could be a nurse practitioner, an anesthesiologist, whoever is deemed, important. Get them on a list, especially the East Bay, and get them over. And I think that this is emergency management. It will prevent certain things.
Right.
But specifically for my oral surgeons, they'll tell me I was sitting in traffic for the X amount of time.
Right.
Now, the governor has been handed a very difficult situation
He
here.
sure has.
And
he's blamed for it, something that wasn't
yeah, and I
wasn't
mean,
his.
I work for a governor, and certain things happened. I was the chairman of the Warwick Sewer Authority, and I think this is an important thing. You probably remember the flood of 2010.
I sure do.
So I remember we were in a room, and 95 was shut down. They were all talking about 95, and I very rarely said something, but I said, Governor, and this Colonel of State Police, I think it was Brendan Doherty at the time, the
Right.
Adjutant General, they all looked at me, and I was like, oh boy, I was just a kid. I was like, maybe I should.
Yeah, but at
maybe-
least Brendan Doherty can look at you in the eye
Right,
because
well,
he's
yeah,
taller than you.
He gave me the look, and I was like, yeah. But I was like, I go, right now, the second largest city in Rhode Island can't flush because at the point Warwick Sewer
Right.
Authority was flooded.
Right.
Now, why is this important? Because I learned on that board, and I later became chairman, was, the jokes are endless, but it's about a $500,000 asset, right? Is that if you have an emergency, right, 80% can be paid by the feds. And if you advocate correctly and talk about the situation, it can go all the way up to 90%.
90%, yeah.
Now with this bridge, right?
Yep.
It didn't implode, thank God. It didn't crash or
And
whatever.
it could have easily happened.
Right, so thank God no one died.
Right.
And that engineer was able to spot it. Problem is if you're in the governor's office or the congressional delegation, it's how do you have a narrative that explains what happened to get the reimbursement? Now,
And to get it up to 90%. if
well,
possible.
right, and now it's really tricky. But unfortunately, you had the Baltimore situation.
Yes, yes.
And so that kind of came
Puts us
around
in
the
the back
same
seat.
time, and it put us in the back seat. But, I know the congressional delegation's doing their best with the governor, and hopefully we can get this going. It's been very, very difficult on our state and the oral health community because, you might have a hygienist that lives in, I don't know, East Providence, and you
Right.
have an office in Cranston. Well, if the hygienist doesn't get there on time,
You can't take care of anybody.
right, and then what happens is, and I always used to joke with the governor, when I worked for Governor Kachiri, if he was late for his first appointment, there goes the agenda.
Exactly.
Same thing in medicine.
Yep.
And it's very rigid. So whether that person's having a problem or the patient, the parent, it was a real, complicated situation. But, I believe in our state and people rallying together. And I think sometimes the negativity and constantly playing the blame game is one of the reasons we're behind.
Oh, no doubt.
I've been on good teams and I've been on bad teams in sports, we'll say. When you're down 10 points in basketball, to make a bad sports reference, the good teams, they come together.
Right.
They're not doing the name pointing. The bad teams, it's, oh, Bob, you stink. and get me out of
You
here.
missed
and-
12 shots.
Right, and I'm going to do it my way, and everyone just goes different directions.
Right.
So hopefully we can, be positive, and it's a very, very, very important issue, and I don't know the answers, so.
Well, I was going to ask you to summarize, what are the issues? I mean, what would you do if you had access to everything?
Well, I talked to him about the Garvey bonds, actually offline to the governor, and
The Garvey bond?
yeah,
What is that?
Garvee.
I think of Garvey. I think it's Steve
Yeah, like
Garvey.
Steve Garvey. And I remember our governor, Governor Kachiri, I'll call him my governor because
Right.
there's so many governors now. But he had spoken to different governors across the country, and it's a way to accelerate the dollars. It's almost like, I'm not a transportation expert, but it's one way, and they're implementing that now. I think that, a lot of pressure is on, Senator Reid and White House to try to come up with a package. And I know I read or watched, the governor who was going down to the White House. So, and until you get the big federal dollars, very difficult.
Right.
And there's just been so much time. And I would say that the problem with this is just that it would be so much better, and no one can predict it, is, hey, this is the timeline, this is what you need to expect. It's messy. And every time it seems like we get a solution, something else happens. So, it's not, I don't want to weigh into it too much because I'm just a executive director of a dental association, but just as a,
Well, you're a politician, though. I mean, you
I
played the
ran
game.
I ran, yep.
You
and,
played the game.
I'll take off my executive director
Yeah, there
hat
you go.
But, I just want to keep emphasizing that the ripple effect to all of this.
Oh, I see
and
it.
on commerce, and especially people like, if I'm a restaurant, let's just say in East Providence, well, most people are going to come from that area, right?
Right.
So they might not get, after it's settled down, get impacted. But our community, the healthcare, so many people are in the different parts of the state, the East
Right.
Bay and the West Bay. And that's where it gets tricky, or the patients. So for example, let's just say you need surgery, Dr. Hartman could fit you in East Providence.
Yep.
Well, now you got to get over the bridge. And, schools and different things. But, I think it's starting to work out. What else would you like to talk about here?
You want to talk about politics?
I can talk, generally speaking.
Generally
I don't want to get, get any hot. And again, I will reiterate, I'm taking off my professional hat.
Yep. But well, before we get off, this thing bothers me. The fact that the reimbursements are so much different between Massachusetts and Rhode Island, and the fact that there's no dental. I didn't realize there was no dental school in Rhode Island.
No dental school. And, we have that great community college of Rhode Island, Lincoln School. Professor Friel and Professor Schmitz, they're the head of dental assistant and hygiene. And, the president, Costigan, and Amy Kemp over there, the chief of staff, we're all been talking about maybe getting some federal dollars, whatever we can do to try to stimulate this and also get it out into the schools to tell them, like, this is a great career path.
Right.
The back office people, the office managers. We got a great program. It's going to be rolled out in 2025. I'm happy to report we had a task force that did something. That we're going to have a certificate program. So what I found was people were calling me, and let's just say it's a mother that had a few kids, has great customer service, and has some background with insurance or whatever they did with being an assistant.
Put them to work.
Well, right, and they call me, and then I connect them to a dentist. They're like, do they have any education on oral health? Because all of the teeth are numbered. You need to know you have to have a certain background to be able to go into it. So I said, all right, let's get everyone together. Let's get CCRI. Let's get some of the major dental offices and hygienists, and what can we do? So the certificate will get a person that has these skills, but just needs kind of a crash course in dentistry and the codes to give them a little bit of a leg up, so when they walk into that office, they're not taking them from ground zero.
Right.
And this is what these ladders to licensure, all of these things that the State House and that they're trying to work on is starting. I was able to, and I should say we as the task force, was able to get this going. We supported it. We're getting other public-private partnership to get it going, and then we'll get that pipeline, because there's a lot of people that are retiring. I was just talking to one of them yesterday. 30 years in the business, knows all the codes and everything. She knows all the families, the friends, the aunts, the uncles. You take that person out of the dental office, they're the first person to interact with the patient or the parent that's panicked. And most of I would say all my dentists, I don't want to speak for all of them, but would say those people are just as important, because when, I have 3 daughters, and when there's something happens to them, it's like, I can't even think.
Right, yeah, I get it.
And I get all emotional, and I don't care what I trained or whatever, and if I don't have a person to talk to that knows me, that settles me down, and then actually has the acumen or the wherewithal to...
And knows what they're talking about.
Exactly. And then can kind of help you with, this is the code that's going to be applied or whatever, especially if, once they get the treatment, then you got to pay for it, and then you got to figure out the equation and how it's all going to be done and completed, the transaction. It's nice to have someone that you can kind of hold your hand through the process. And so, really happy that, CCRI is a great partner, and, people are looking at that. So, we started kind of from ground zero with a lot of different things, and we're, back on the map, and, I'm hoping to have a good legislative session.
Now, CCRI couldn't do a dental school because they're only a 2-year school, right?
Right, they're a community college. It would have to be, and there's so much upfront costs now.
Right.
Setting
it up.
Yeah, I mean, URI, they're trying to do a medical school. I was happy that, they put primary care in part of it. I'm like, well, what about oral health?
Right.
So we're encompassed in some of those conversations as they go along. I was just with the president at the URI football game. They were talking about saying yes on 2, that, a higher education bond that will help URI and Rick and the biotech. Like, all of these types of things is momentum to hopefully, grow an economy. And one of the biggest economies right now is healthcare, with AI and all the different discoveries they're making. So, I'm at the forefront. I'm so lucky, because I didn't really know a lot about healthcare.
Right.
It's probably my biggest weakness in policy, if you talk to me about it being, running or being a politician. And now I've been sort of educated with just the great professionals.
And
of
something
Rhode
you
Island.
didn't know anything about, and all of
Yeah.
a sudden now you
Now
know a lot about it.
Right. And when I don't know, I really try to stop.
Right.
Because the danger is you get educated on some level, and then you try to be some sort of person that you're not.
Right.
I'm not a dentist.
Man's got
I'm not a hygienist.
Some famous
Yeah, right.
actor once said,
Right.
man's got to know his limitations.
Yeah, right. Well, it's time to stop, Aaron, and hand it over to the professionals.
Yeah, give it to somebody else.
Yeah. So that's been good. But, another thing is we have the Molar Express CCAP, which is another.
The Molar Express?
Right. So I learned this.
The Molar
So they have these, Molar, but it's a mobile dental unit. It's like a
Right.
bus that's outfitted with dental chairs.
Yep.
And they drive up to, let's say, Bain Middle School, and the kids that were identified through these screening process or whatever go out and they get the help in the van. Ronald McDonald House has been does the grants for this particular thing. The problem is that this bus can go to Cranston and other parts, but it can't go to Providence.
Why?
Because that's not what the grant was written for. And that's not the group that's going to support it, right? They all have their regions. So really trying to focus in on maybe, I have big dreams
Yep.
of trying to acquire one of these mobile units.
Right. For
and-
Providence.
For Providence, and maybe start small.
Yep.
Do one school and see how it works. Try not to be a miracle maker right off the bat.
Right.
See if you can get the right people to do it, the hygienists, the dentists. Try to get some of these kids some help, like the George J. West, which is really the epicenter. I just can't believe it. I can't believe the numbers. I thought they made a mistake.
Really?
And over 80 kids. It's just insane. So I really am.
And these are kids that are in real danger of medical.
Well, yeah,
with their teeth.
There was a summit, a healthcare summit that the speaker and Senator Whitehouse put on in May, and the Attorney General spoke, and great, all these different state office holders, as many people want to lob things to them, open, listening, wanting to do things if they can support or help. But, one of our doctors said it's going to take a child to die before someone really jumps in.
Well, that's scary.
And, I am really trying to prevent that sort of tragedy to happen.
Right.
So when I get on these types of shows, it's amazing how, you have a following. You've been doing this for over 30 years. People watch it, maybe late night, whatever it is,
Right.
and then it's like, hey, maybe I know Aaron. Give him a call.
Right, exactly.
And maybe there's something that I don't know, and they can support us.
Well, how do they get a hold of Aaron?
So our office number is 401-825-7700.
825-7700.
Yep, we're not a dental office, so we can try to connect, but we don't want to be like a dental 911. We're not
Right.
made for that. We're a trade association.
Right.
We're located diagonal from the YMCA over there.
The YMCA
on
where?
Centerville Road.
In
Warwick.
on Route 117.
Yeah, Chick-fil-A.
Chick-fil-A.
Right around the corner.
I always make reference to state routes because I know every route in the state of Rhode Island.
Oh yeah. Well, that's when I was driving Don Kachiri during the first campaign.
Right.
We had maps.
Right. Yeah, the old fat.
And when I was in Burrville, I was laughing. One
Yeah.
time we were out there.
Oh,
and it was
you got
pitch
95,
black.
Route 100, 101,
Yep.
102, 99. they're all up
Seven's
there.
out there. It's
7.
And we were like, it was dark, and we had no idea. And you couldn't. Or trying
And that
to
was
look
before the GPS.
Well, yeah. There was still. I knew it was available, but Don and I. He was Don at the time. We weren't going to be able to do that. So
Right.
anyway, we had some hairy situations out there in
I'll
the
bet.
western part of the state.
107 too, by the way, is up there.
Yeah.
117's all the way up there too.
Oh yeah,
150.
Coffee and Cream now is up in North Smithfield. You got so many, great places, and there's just so many nooks and crannies to the state. Like I'm looking forward to go apple picking this weekend maybe, or the fall, coming up. That's always fun to do with
Yep,
the kids and drink a lot.
Where do you go?
What is the one in Johnston? What's the one called? They do the cider.
God,
It's
I
going to
can't
come
think
to
of the
me.
name of it.
But gosh, it's going to drive me crazy.
Begins with a C.
Yeah. It will come to us. So we don't
Yeah,
talk
yeah.
about it.
Unfortunately, it'll come to us after the show's over.
Yeah.
Yeah,
But,
there's so many. By the way, there are so many farms in this state. When I was working for Dan McKee,
yeah.
we started that 39 community thing.
Yeah, there's the Rhodey milk. I remember that was something that Governor Kacheri was behind, and I had no idea at that time how
Was
many.
that in Portsmouth? Is that the one that's in Portsmouth?
Well, Rhodey milk was across the state, right? They got this, and then they had Rhodey meat, and it was just a statewide initiative to help these farmers, and then they
right.
got.
But I mean, the farm itself was in Portsmouth, I think.
Oh well, yeah, I think they start. Yeah, one of them was out in the East Bay, but like just even in my town in East Greenwich, there's different farms,
Right.
and again, like when I was driving around when I got this job, I was like, oh, there's an orthodontist, there's the dentist, the
Right.
commercial.
Well, you're seeing them
buildings.
now, yeah, because now you're in that business. It's
Right.
like when you buy a new car.
Right.
If you buy a Volvo or something, all of a sudden you're seeing Volvos everywhere. If you buy
Yeah.
a Toyota, you're seeing Toyotas everywhere.
Yeah, so I'm amazed that sometimes, and when I've gone door to door, whatever the reason is, you start to see things in a different light.
Exactly.
And I'm really proud because this is a critical time for the oral health, industry.
Yep.
And if we don't have people, creating solutions, there's a lot of burnout. There's a lot of people that are, there's a lot of, we're really making we're talking about wellness in a lot of our component meetings and our continuing education meetings. Because they feel isolated, and the biggest problem with some of these dentists is they're running a business,
Right.
they're doctoring, and they have to do it all, and there's inflation, and then they're constantly being interrupted in their whole day.
Right. And
You
the
know,
bookkeeping and all that
bookkeeping.
stuff is
and
tremendous.
I don't care what it is, right? We only have so much bandwidth.
Yeah.
And if they don't have a chance to call somebody, I've learned over the years, when I get isolated, everyone goes ups and downs in life. It's sometimes I call a guy like you. I don't care how serious the situation is. We identify, make some jokes.
Right.
Maybe we have a cup of coffee, and it doesn't feel it's like, all right, now I can.
Not overwhelming.
Right. We got a
It becomes
chance.
less overwhelming. I
Right,
should
and then it's like, all right, and maybe you say, hey, you should talk to John at this group.
Right.
And he's helped me, and because we're connectors, right? And
Oh, you got 5 seconds. You're
5
done.
seconds.
You're done.
Well,
kid.
oral health matters.
Oral health matter. What's the number again? You want it, or the email address? You got
yeah,
a website or?
Well, I mean, it's the Rhode Island Dental Association. Our phone number is 401-825-7700. And, for anyone that's a dentist that's not
Right.
a member of the association,
Right, there you
please
go.
call me.
There you go. All right. Well, Aaron, thank you for stopping by. And guess what? You just spent an hour with Bob.
All right, Big Bob. Thank you again. I appreciate it.
Thank you.
Yeah.
And folks, I'm hoping that you learned something from today's show, because I certainly did. And we need more dentists, and we need a dental school in Rhode Island too. Talk to your legislature. Thank you for spending an hour with Bob and Aaron. Until next time, see you.